And get started. I would like to welcome everyone to today's FAST-TRAK training lab. Today's session is brought to you by TRAKnet Cloud. You can take your TRAKnet anywhere you have an internet connection with TRAKnet Cloud. My name is Tony, and I'm the TRAKnet client trainer. Joining me today is Erica, who is one of our customer care representatives. In this webinar, we'll be covering questions which you as our clients have when using TRAKnet program. All users will be in listen-only mode, so please post all questions to the questions box on the webinar menu. Also, please verify that your TRAKnet version is up to date. I have the current TRAKnet version on this now, and I will go through how to verify that. So in TRAKnet, once we're logged in, we go to Help, and we click on our Check for Application Updates, and TRAKnet will check for any current updates to the program. All right, and Erica, go ahead and start us off with our first question today.
Okay, thank you. The first question that we have is, what do you recommend we input on the medication list if the patient is not on any meds?
Okay, if the patient's not on any medications, you would not want to enter anything on the medication list. Your medication links are going to pull over. Let me find one here that has it. And we'll take these off. So if you have nothing on your medication list, your active medications, anywhere you pull a link is going to say no active medications. So if you have no active medications, you want to enter in no, just want to leave it blank.
Okay, thank you. The next question that we have is how to use the specialty registry.
All right, there's the feature for special registries is under our reports menu. It is the specialized registry here. On the specialized registry, you're able to do a search for the information your registry will need. Now, TRAKnet does work with MedExpress, so if you have a MedExpress account, you can go under the options and enter in that integration information. And when you select MedExpress, it's going to automatically select the ICD-10 codes that we're looking to report to MedExpress for that registry. And I will need to close and go back to it to clear that out. You can also use the wound care. Now, TRAKnet's not currently integrated with wound care, but it will track that you submitted to wound care, and you can use the none option. When using both of those, you type in the ICD-10 codes that you want to look for, that you're going to be reporting for. You do a search, and then once you've done the search, you'll select the records that you want to have. I don't believe I have anyone that'll qualify here, but let's take a look. There we go. So we select the records that we want to send over. If we have our Med and we're working with MedExpress, we can click the upload button. It uploads directly to MedExpress. If we do not, we can click the export button, and that'll ask you for a location to save that at. You save it, and it creates that CCDA batch for you. Tells you where it placed it at, and then you can send that file over to the special registry.
Okay, perfect. The next question that we have here is how to merge a patient.
All right, merging a patient in TRAKnet is done using the Merge feature under Tools. On the Merge feature, the top patient is going to be the record that's going to stay. So we'll search for our patient on the top. And in the bottom record is going to be the record that's going to merge with the top patient. So we would select the patient that we want to merge with the top patient, and then click the Merge Patient button, and that'll merge their information together, making the top patient the only one remaining in the database.
Okay, what is the audit log used for is the next question.
All right, the audit log has three different sections. It has our logins, which allows us to view an audit of logins on the computer. So this will tell you who logged in under what user and when they logged in under that user. So that would be a good audit to show as far as who's been logging into your TRAKnet. If someone who's not supposed to be there's ID is being used at a time when they're not supposed to be being used, that's what that login's going to give you. Your prescriptions and refills is going to give you an audit of prescriptions and refills done in TRAKnet. So it'll tell you who did the prescriptions, when they were done, all that information. And then the patient audit log is going to show you who changed information on the patient. So if you have a situation where an encounter was created and then removed and you want to know who removed it, you can go to the audit log and it will tell you who performed that action of removing that encounter. So the audit log is really a kind of a step-by-step trace of what's going on in TRAKnet.
Okay, and how to add and remove the patient image?
Okay. Adding a patient image is fairly easy. We click on the No Image Available. That's going to bring up our capture screen. We could decide the camera that we're going to use. In my system, it has 3 different cameras. We capture the image. We click Continue, and it imports that right into the patient chart. Once the image is in the patient's chart, to remove it from the patient's chart, we simply remove that image file. It's going to be the file here with the strange name on it. We can either do that by deleting that file, or if we want to keep a copy of those, we can have a folder. And just move it to that folder. So that way when we go back to our patient, it's no longer there.
Okay, perfect. How to set permissions for the office staff is the next question.
Okay, permissions is done under Properties, into Users Group. To set permissions, we select the person that we want to set the permissions on. We double click to bring up the editor window, or you can click the Modify button here. There's a Permissions tab here, and each of these boxes that is checked is something the person will have permission to access. So if you don't want the person to have permission to access the billing section, you uncheck that, and that takes that person's permission away for the billing section, so they wouldn't be able to see anything billing when they're going in. If you don't want them to have access to remove items, you can remove the access to remove and restore. And then a couple ones that are important that we like to recommend is the time clock and the users, because removing the time clock prevents them from changing people's times, and removing users prevents them from being able to go in to their own user and change their permissions. Once you've saved it, you'll have to restart TRAKnet if you're the user that the changes are on. And then those users will be applied and they won't have access to those sections in TRAKnet.
Okay, perfect. We did have a request, Tony, to go back over the MedExpress area. Can you give another brief run through that?
Are we able to get a specific question as far as the...
Well, I can ask if there's something specifically, and so we can go on with another question, and then I'll wait for an answer for that. How to reprint the collection letters?
How to reprint a collection letter?
Yes, sir.
I don't know if I can demonstrate that in my system. Once you've printed a collection letter, let's see here. don't think I. All right. Just a moment. I'm just working through the process of actually printing one. I'll have to get back with them on that one because it's not putting the person that I had selected into collections. Here we go. Yeah, I'll have to get back with the client on that one. It's not placing my person into collections as it should be, so I'll have to look into why that's happening. But you should be able to go back to the person, either through follow-up or in collections, and print that same collection rule out for them again.
Okay, no problem. The next question that we have here is how to add lab vendors.
Okay, lab vendors can be added straight from the lab order under orders. When you go to add and you go to your vendors, if you don't see the one that you need, you can click the add button there, and that's going to allow you to add the vendor in. And then under vendors on your properties tab, it's going to be the same thing here. You can review the ones that are there. If you don't see the one you need, you can click add and add the vendor in.
Okay, and I did receive a reply back from the MedExpress question. She's inquiring about how to get MedExpress and how it works for the practice.
Okay, well, getting MedExpress is something where you would have to contact the MedExpress. I lost the word for it. You'd have to contact the MedExpress registry. They would set up on their side. Come down to the options to integrations and enter your MedExpress account ID and password here. That's going to be emailed over from MedExpress, and you need to enter it in very specifically exactly what they send over. Then under reports, when you have that MedExpress information entered, you'll pull these codes under the MedExpress registry, which I don't get anything because I don't have any patients with those codes, and then click upload, and that sends it over to MedExpress. Now, it is very important that the password and account be the same as what they send in the email. If it is not, you'll get an error back from MedExpress indicating that that's not the correct password and username.
Okay, perfect. The next question that we have is how to make the secondary insurance information show up on the CMS 1500 claim form.
Okay. I assume for that we're talking about on a preview.
Correct.
Because when you're printing out, if you're printing out the actual claim to send out by paper, it's going to print according to what sequence is set. So when you're on your CMS 1500 preview in the invoice, if you click your drop down and select your secondary, that's going to give you the secondary information in that preview. And that goes the same with tertiary. You just click the drop down and select tertiary, and you're going to have that tertiary information. So the preview is going to show you what information for the sequence that you have selected. And then when you print out from here, it'll print according to the sequence that you have selected.
Okay, thank you so much for that. And the next one, it's kind of a good piggyback off of that. How to change what's in box 24J.
Okay. I'll bring up 24J here. Box 24J is going to be on our treatment line. It is the special codes for your provider, your taxonomy codes. Give me just a moment while I look up exactly where those are at here. And I apologize, I had that spot where they were at just a little bit ago. So we're going to go to our insurance. We're going to review our send legacy number field. So send legacy numbers here. If that is set to true, I'm going to go to legacy numbers and add the appropriate legacy number. So you have the option of true or false for legacy numbers, and then you set those from that legacy number tab to what you'll be sending over for that provider. So you can add in for facility provider, referring provider, depending on which legacy number you're adding in, and that'll change what's in box number 24J.
Okay, thank you. How do we view deleted payments? Is the next question.
Okay. Deleted payments can be viewed from your billing dashboard. Let's see if I have any in here. You click the show deleted and refresh, and you'll see any payments that have been deleted for the time frame you're searching for. So it's like with several other areas, if you click that show deleted, it's going to show you what's been deleted in red.
Okay. The next question we have is, why am I getting a truncated data error when adding the insurance?
Okay, that's an excellent question because that doesn't come from the insurance itself. When trying to add an insurance, especially with users that have been with us for some time, we may see an error that says truncated data. So what will cause that is if we have letters in that phone number field. Now, TRAKnet 3.0 will not allow more than what the phone number is supposed to have in it to be entered in. However, like I said, if you've been with the program for a while, you may have been working in 2.0, where it did allow those additional characters, and when you go to add in that insurance, it adds that patient phone number, and when it tries to add that patient phone number, the phone number doesn't fit the field it needs to go to, and that's where you get that truncated data error. So if you see that, check that patient phone number for anything above the 10-digit phone number.
Okay, perfect. The next question that we have here is how to refund a check.
Okay, you mean refund a payment?
Sure.
All right. There's a couple of methods to doing it. If it is a credit card payment that was processed through TransFirst, you would want to remove that payment from TRAKnet. That's going to send a notification over to TransFirst to advise that the payment needs to be refunded. So if you just did it, it'll let TransFirst know to void the payment and not charge the client. If it's been a few days, been a little bit since it was done, it'll let TransFirst know that that payment needs to be refunded back to the client, and then it'll be refunded back to the client. The other method is going to be through a provider payment. We do the provider payment by searching the specific patients. And to do a refund, you would do a negative amount. So say the patient had overpaid on one of their line items. Which we can actually look through here, see if I have any that have a credit. It doesn't look like I do. Let's try training. I don't have any that currently have a positive amount, but by doing a negative payment to it, so if we do a negative $10, it does a refund amount to that line, and it results in deducting that amount off. You click Commit Adjustments. You select the appropriate payment type, which in this case you'd want to have that refund payment type in your system so you can save it as a refund, and then you click the Save button to save that refund.
Okay, the next question that we have is how can we make an insurance auto-populate the adjustment when we put in the allowed amount on the payment line?
Okay, that should only be done for primary insurances. So it's a setting on your insurance on your patients, on your patient chart under billing. We go to Claim Details, and that is Auto Adjust. Auto Adjust is going to automatically place the adjustment in for that insurance and should not be done for secondaries or tertiaries because it will result in a additional credit amount for the client in excess of what the client's supposed to have. So we can actually take a look at this Medicare check here. We can see Enable Auto Calculation is checked. When I type in my allowed amount here, it automatically enters that information in.
Okay, thank you. And the next question here is, let's see, what does the CCDA button do in the patient's chart? And if pushed in error, what happens?
The CCDA button on the patient's chart is a shortcut to sending a CCDA for a patient. It is the same as going down to patient engagement, selecting the default statement, going to Actions, and clicking Send to Portal. So by clicking that CCDA button, you're doing all that in one click. A couple things to keep in mind is it uses the last encounter created. So if the last encounter created is not the one that you want to send, you would want to go down to patient engagement where you can select a different encounter. And it will not be able to send it to the patient portal if the patient does not have an email. And then if it's clicked in error, it's still going to send the message over if the patient has an email. There's not really any way to retract that message. So if it is sent in error, it may be an idea where you might want to contact the patient, let them know it was sent in error, but it doesn't really cause any harm in the system. It just sends over the CCD for the last encounter made.
Okay, thank you. We have a little time for maybe a few more questions. The next one here is how do you get the patient name to appear on the phone message when printed out other than typing it in manually? It used to automatically print the patient name and date of birth, but date of birth, since the recent update, it no longer identifies the patient on the printed document.
I don't think there's currently a way to do so, but let me take a look here. Yeah, there's not currently a way to do so straight from here without actually typing it into the note. That would be something I would definitely say would be great to be sent over as a recommendation, a suggestion. We have a new suggestion here, our TRAKnet suggestions forum. That'd definitely be something that'd be great to send over for that, because yeah, currently what you're printing is just what is in the document itself. It's not printing any of the other information.
Okay, thank you.
Looking at the last question I see here, I think we have someone that might be a little bit confused on the webinar. The macro webinar is actually going to be later this evening. It's going to
8
be
p.m.
Yeah, 8 p.m. So that macro webinar will be later today at 8 p.m. This one is the FAST-TRAK training webinar.
Okay. And we may have time for another question here. Is there a way to track inventory?
Okay. TRAKnet itself does not have an inventory tracking program. We do, however, partner with DocShop Pro, which offers inventory management through their website. And there's a link to that DocShop Pro right when you start up TRAKnet, and it'll take you right over to their website.
Okay, perfect. Can we export a list of referring providers?
We can. What we're going to do is we're going to go to our reports. Our query, and go to referring providers. Once executed, you can export that list to it'll be a CSV document, so it can be opened by Excel or any other programs that open CSV documents. All right, looks like that's just about all the time we have for today. For any questions that were not answered during the webinar, our client support team will be reaching out to you to get those questions answered. I also want to remind you that we have additional resources, our YouTube page, which is definitely a great location to find different videos for how to perform different things in TRAKnet, and our TRAKnet wiki page. And thank you everyone for joining us today, and have a wonderful afternoon.